Our topic today is about Denosumab treatment of osteoporosis in postmenopausal women. Osteoporosis is a disorder of the skeletal system characterized by compromised bone strength, predisposing patients to an increased risk of fractures. The receptor activator of RANK is expressed on osteoclasts. The interaction of RANK with its ligand is the final common pathway through which bone resorption is regulated. By binding to its receptor RANK on osteoclastic precursors, RANK ligand controls the differentiation and survival of osteoclasts. Osteoclasts cause bone resorption and breakdown when osteoclast activity exceeds osteoblast activity. Over time, osteoporosis occurs. Menopause causes a decrease in estrogen levels, resulting a decrease in bone strength and an increase in bone resorption, leading to possible fractures. 80% of people with osteoporosis in the United States are women, and 1 of 2 women older than 50 years will have a fracture due to osteoporosis during her lifetime. Women with osteoporosis who are considered to be at high risk for fracture include those with previous osteoporotic fracture or multiple risk factors for fracture, or those who have failed or are intolerant to other available treatment of osteoporosis. Denosumab has been approved by the FDA in June 1, 2010, for the treatment of postmenopausal women with osteoporosis at high risk of fractures. Denosumab is a fully human monoclonal antibody that inhibits osteoclast-mediated bone resorption that causes osteoporosis. It is indicated for the treatment of postmenopausal women at high risk for osteoporotic fracture. It is administered as a 60 mg subcutaneous injection every 6 months. It works by slowing bone loss, to help maintain strong bones and reduce the risk of broken bones and fractures. Now I'm going to tell you about Denosumab mechanism of action. Denosumab targets and binds to RANK ligand, preventing activation of its receptor, RANK, on osteoclasts. By binding to RANK ligand, Denosumab inhibits osteoclast formation, function, and survival. Denosumab prevents the maturation of osteoclasts, decreasing bone resorption and breaking the vicious cycle of bone destruction. In a 3-year, randomized, double-blind, placebo-controlled trial called Fracture Reduction Evaluation of Denosumab in Osteoporosis every 6 months, enrolling 7,808 postmenopausal women aged 60 to 91 years, Denosumab was associated with lower incidence of vertebral, non-vertebral, and hip fractures in women with osteoporosis. The drug was administered as a 60 mg subcutaneous injection every 6 months versus placebo at 3 years. The results of the study were a 68% reduction in vertebral fractures, a 40% reduction in hip fractures, and a 20% reduction in non-vertebral fractures. The study also showed that there were significant increases in bone density at the lumbar spine, total hip, and femoral neck with Denosumab use. To have a sustained benefit of Denosumab for osteoporosis generally requires continued treatment. Its effects may not be sustained once treatment is terminated. The most common adverse effects reported with Denosumab are back and limb pain, musculoskeletal pain, hypercholesterolemia, and urinary bladder infections. Serious adverse effects include hypocalcemia. For this reason, adequate supply of calcium and vitamin D should be taken with Denosumab. This concludes all of my presentation. I hope you all enjoyed it, and learned something from me today.